Welcome, everyone. This is the Tinnitus Virtual Summit. My name is Dr. Ben. I am the host. Today, we are here with Christina Callahan. Christina is a doctor of audiology, and she's the head of clinical audiology at Lively. I'm going to allow her to explain what Lively is in just a moment. And I wanted to bring Christina in because I wanted to ask her how she has seen COVID-19 affect the audiology and tinnitus communities. Welcome, Christina. Would you please be able to explain Lively to our audience and then also comment on COVID-19 and how it's affecting everything?
Absolutely. So at Lively, we view ourselves as a care platform, and we're building a telehealth platform that could go beyond hearing aids. Right now, that's the avenue we've taken, and we've really helped a lot of people have more affordable and accessible hearing healthcare. And it's amazing every day to see the impacts it can have on someone's life and the positive impacts it can have on the family overall and their friends and their loved ones. And, right now, in COVID, it's, we really feel fortunate that we've built a model that we're able to still serve the people who need us most. But, we have seen the impacts of COVID. It's been mixed, some that, they've lost their livelihood suddenly. And now as much as they value their hearing, they can't afford anything if they don't have, they might not have insurance coverage, they might not have a lot right now, and now they aren't going to be able to pursue it. Or, the other hand, a lot of clinics have been forced to close their doors, so a lot of people have come to us as the only place they can go, and we're happy we're there to be able to give them an option if they can't go to their audiologist they've been with for a while right now, and to have something right now to support them during this time. So I think we've seen what everyone is seeing during this time. It's affecting everyone very differently.
Yeah, thank you. And as we know, as audiologists, about 80% of people with tinnitus have some degree of hearing loss. So tinnitus and hearing loss are very connected and related. For some of our viewers who have bothersome tinnitus, that's why they're here for the Tinnitus Virtual Summit, most likely. I want to ask you what you recommend to someone who has tinnitus but hasn't gotten a hearing test, and maybe they've noticed they're having some hearing challenges in their everyday life with family, at work, etc. And then they go on the internet and they start to learn about hearing aids that you can buy online, and then they may come across Lively, your group, or they may come across a local audiologist or hearing care provider. Would you be able to explain some of those differences and what to look out for someone who has tinnitus, please?
Absolutely. Well, when they come to Lively, we see a lot of people have tinnitus of varying degrees. Some have it, but it's not very bothersome. It's just something they say, hey, I have it. Is there anything to do about it? And there's some that it's really, really impacting their lives. The most important thing we have found when we work with these people is you have to validate their concern. So, as an audiologist, especially an audiologist that works with hearing aids, sometimes naturally someone comes to you with tinnitus, you're assuming they have hearing loss and you're assuming that's the solution you're going to be providing them. And if the person or the individual feels that, they're not going to feel their concerns are being heard, and they've told us this before. So, our audiology team, the first thing we say, if they're, complain and their concern is tinnitus, handle that first. Ask them questions about their tinnitus. Don't just assume what's causing it. To the best of our ability, do some really good interviewing and asking questions about their case history, their medical history, their health history. And then, really assess how bothersome and how much it's impacting their lives. Once you get to know them and their issue, then you can move towards, okay, like you also said you had a ton of trouble hearing. And then if we know that it's what it likely is related to hearing loss, then you can go into explaining what options there are. I think it's important not to just jump to saying there's nothing that can be done. There's no cure for tinnitus. You have to be honest about those things. You definitely have to be transparent and make sure it's known. But to start more positive and hopeful and saying, well, this is what the options are available. This is how successful these options are. This is the potential for it, how it's going to get better, hopefully with the support of a professional. And also if it doesn't, this is, having those conversations as well. I find that, many times think that we take the time to educate them on their tinnitus, explore their case, and they feel like it's personalized and really thought out advice for them. before again jumping to any conclusions. And then of course being willing to use what we can in terms of resources with hearing aids or a sound generator. And we do a mix of, if they have hearing loss, yes, we'll talk about hearing aids, but we're honest about, you know, what the sound generator and the hearing aid can actually do, how it works, not just say, yeah, it has a tinnitus feature, it'll work. That doesn't set a really great expectation. And understanding that if they're going to use a sound generator, the commitment in, you know, that they have to use it appropriately for it to be the most effective. So we do a mix if they have hearing loss, that yes, we'll recommend hearing aids for the hearing loss, and say, yes, there are some individuals that experience benefits with tinnitus just by wearing the hearing aid itself. We can start there. And then once we start there, we'll explore where we're at. And then from there, we can explore a sound generator within the hearing aid itself. Or if they don't have hearing loss or they're not ready for hearing aids, I don't think our job is done. There's a lot of free apps out there that give them a resource and can expose them to this type of technology. You know, we recommend the Resound Tinnitus Relief app all the time. It's a very flexible app. There's different things you can do. You can choose your own, you know, specific sound that's soothing to you. And we really teach them towards a habituation technique, that you don't want to mask and cover up your tinnitus. It's like a temporary Band-Aid when what you really need is stitches. You know, we really want to work towards changing your reaction to tinnitus and it not being such a bothersome part of your life. And that's part of why I really like your channel, Ben, so far, because you talk about sort of holistic health in this whole process, and it's very important to discuss with people.
Yeah, thanks for the shout out. So I agree that having professional guidance to treat hearing loss or to improve relationship with tinnitus is very important. And what you guys do at Lively, from my understanding, is that you're providing professional best practice, gold standard counseling and guidance, while also having a convenient way for the patient to improve their hearing without leaving their home, using the internet, using mailing devices. So I was reflecting how long has Lively been around? When did you guys start your group?
Yeah, so the founders came together July of 2018. So in a short 2 months, it'll be 2 years. I joined Lively in October of 2018. I was one of the first people at Lively, where it was just, there's only 4 people in an office that we were sharing with our incubator. And you know, from there, I remember we did a lot of beta testing, since, you know, we were doing something different. We were testing, can we use an online hearing test, program this hearing aid similar to what we do in the clinic, and fit the hearing aid online remotely through video consults, through the leveraging the remote assist and the Resounds technology. And can we do this well? Can we achieve great outcomes? Or, you know, and equivalent outcomes to the clinic. So, you know, from there, when we tested this out, the first thing I saw with our beta testers was, you know, they reported that the convenience, not having to leave their home. And we had a whole, you know, host of people that had different reasons, from, you know, certain health conditions that meant they had to hire someone every time they wanted to leave, hire a bus. And it just wasn't worth the trouble to them, or it wasn't feasible, you know, being able to unlock care for that person. Some just didn't want to go through the process. They were near a clinic, they just weren't doing it. But I always say that just because someone's not willing to go through the traditional in-person practice doesn't mean they don't deserve to hear better. They do, and we need to meet them halfway and, you know, keep them as safe as possible. So, you know, from there, and then working with hearing aids, naturally, you know, tinnitus and hearing loss, that comes into play. We work with adults. It's not something we work with children quite yet, for many different reasons. And yeah, from there, we launched officially to the public, where we were, you know, website was up, we were selling hearing aids and our care platform in February of 2019. And, you know, to date, we've grown tremendously. I was once the only audiologist. Now I manage a team of 6 going on 7 audiologists across the country. And, you know, in terms of our outcomes, you can't deny, you know, what our clients are saying. You know, they've been our biggest promoters. We have a net promoter score that's equivalent to some, you know, the leading companies out there in customer service. You know, the reviews we get, the thank yous we get, and, you know, we use the COSI, so the client-oriented scale of improvement. It's a measure of success for very specific goals that are customized or individualized for that person. And, when we compared our results from, a remote model to when we do have an in-person clinic, as well as when we use this online hearing test versus a traditional audiogram and starting that route, we have equivalent outcomes of satisfaction. So it just tells us that what we're doing is important work and we have to continue to grow and optimize it. And that includes, when we're working with people with tinnitus, yeah, that same level of counseling and understanding, and also knowing when it's time to refer, when there's limitations. Transparency is also a very important value of Lively, and we want to bring that to the hearing industry overall. So yeah, that extends all the way to tinnitus.
Thank you. That was a nice little lesson about what you guys have learned. And yeah, being in that startup culture, beta testing, I imagine there's a lot of meetings and brainstorming and taking the beta test group about their feedback and implementing it. And it's quite interesting that over the past 2 years, your team had fully believed and invested in this telehealth model through innovation. And now in 2020, the rest of the industry, the rest of the majority of hearing providers who are in a physical location face to face are now trying to learn and catch up. So what are your thoughts on that, and what have you guys learned along the 2 or 3 years about telehealth, or about how to meet the needs of someone through a computer, through the internet, through mailing devices? Do you have any comments on that?
Yeah, a lot. I mean, this is something I feel very passionate about. And I hope that beyond this pandemic, that people will consider, hybrid models even. I by no means think the in-person model needs to stay as well, but the remote model, we can see more than anywhere, even the non-believer has to admit that we need something, because how do we reach people during a time like this? Um, you know, uh, Sorry about
No problem.
that. So, the most important thing to keep in mind is, a lot as a professional. That's what I would say to professionals. You're so much more than your equipment. You're so much more than dependent on the hearing aid in itself, your audiometer, and everything else. Like, you've committed, all of us have committed so much time to educating ourselves in this area and being the experts. And we have to just not kind of be too tight to the textbook, have some trust in ourselves and our professionalism and our ability to help people. And I think we have to stop seeing us as the leader, but a guide. What has changed me throughout this experience is the more and more that, you enable and you empower an individual to help themselves and their health and their healthcare and lead it. And you are their coach to make sure that you can give them as much information, you educate them so they can make an informed decision. And you could definitely cut in if they're about to make a decision that isn't best for them. But, if they're making a decision that maybe wouldn't be your top recommendation, tell them, why you would recommend something different. Tell them, what they want to do, what the benefits and the challenges could be. And again, just trusting yourself in that individual. You have to rethink everything we've learned and everything we've done if we're going to adapt in a time like this, and in a time of technology changing. I mean, our industry changed a lot when over the counter passed, and audiologists have to not think and not act on maybe some sort of existential crisis of our value if it's different than how we were originally trained, but that we are very valuable and we are beyond these things and we can adapt, and we're going to help a lot of people hear better through different avenues as well. The specific recommendations is don't assume, people can do a lot. Even don't assume that because someone's older that they are not going to have a smartphone. Most of them have them. That they can't use an app, or they're not motivated to learn how to use it. Something that's cool too at Lively, and we will recommend that they use the Lively app, which is how they control their hearing aids. Or again, we use the Resound Tinnitus Relief for people who do want to use the sound generator. We make them almost like tech experts. Our customers, our care team, they'll sit and teach people how to use their phone. They will sit and teach them how to navigate these different apps and use it. And this will now empower them in other parts of their health to use telehealth services. So we're doing so much more than just our job of helping them hear better, helping their tinnitus be less bothersome. And we, again, the appreciation we get from everyone, I wish everyone could see it, because then I think everyone would be that much more motivated to launch telehealth platforms of their own.
Yeah, what do you think are the biggest myths or misconceptions that an audiologist or a potential client or consumer has about an online hearing aid model or about Lively?
The first one, that it's not personalized. It's not custom. I hear, oh, that can't replace face-to-face care, but a video is face-to-face. You can form relationships and rapport and build rapport through a video. And the other thing, this is telehealth in general, the use of, telecommunication platforms, you have more opportunity to have more frequent follow-up, more efficiently, so that maybe you can actually track outcomes more closely, you can be more available, and not with taking more time. I with my team, when we compare the amount of orientations, that's what Lively calls the initial fitting or dispensing, some other clinics call, we can do in a week what some people pull in a month. Not because we're rushing people, not because we're not being thorough, but because there's built-in efficiencies with using telehealth. So that would be, I think, my first myth. I've heard providers worried that it would be less personalized. I've heard providers worried, well, how do I turn off? Like, clients or patients are going to be, trying to call me at all hours and all day, and it's going to take more time. It really doesn't if you set it up correctly. And again, you manage expectations. And then, the other big myth was what I said, that an older demographic can't handle it, won't be able to do it. Not that there's not people who can't do it. Of course, there's people that it's not right for and really need not just face-to-face, but in person, very hands-on, physically hands-on care. But even the ones that are very low tech savvy, yeah, it might take longer. They can do it. And you can give them access. So that would be the other myth. More people can handle it than one may think. So
Yeah, that's really important. I was just thinking about how when I'm having consultations with tinnitus patients and I'm having calls over video, and the ability to give someone options of how to potentially improve their hearing is important. And we live in a time where there's infinite options at the grocery store, shopping online, going outside, walking down the street. There's so many ways to live, so many choices to make. So from my perspective, if I'm working with someone who has bothersome tinnitus, and that's what we're focusing on, improving their relationship and how they're living with tinnitus, for that person, there's a chance they have some degree of hearing loss, or there's a chance in the next 10 years they would benefit from hearing aids. So from my perspective, being able to communicate with them, okay, you have options. You can buy something very cheap yourself, which would probably be hard to learn how to use effectively, or you can get something convenient online that also uses professional services, and I would say Lively is one of those examples. Or you can go for the classic style of see an audiologist face-to-face in a clinic, where you'll have more physical in the same room time together, and being able to give the individual those options, they make the decision that feels best for them. So from my perspective, I applaud what you guys are doing, and I think you're going to continue to have more and more success. Would you like to tell people where they can find information about Lively or about any blog or video resources that you guys have?
yeah, absolutely. Well, our website would be the first stop. It's just listenlively.com. We also have a YouTube channel. We mostly use it for self-service videos so that our clients can, learn how to pair their phone to their hearing aids and change batteries and wax guards and things like that. But we also have some, information. I have a video up there on like kind of how to get a telehealth program started quick, for those of you who want to know more about that. And yeah, that would be it. Everyone, I don't know if you give my contact information out, but I'm happy to answer questions directly as well.
Okay. Thank you, Christina. And for everyone, this is the Tinnitus Virtual Summit. Make sure you watch the other videos. There's over 10 interviews and presentations from speakers from 4 different countries who each have their own amazing audience. And we have chiropractors, psychologists, audiologists, people in the hearing aid industry. So the purpose was to bring us all together, and make sure you check out those other videos. We're here right now with Dr. Christina Callahan, who's the head of clinical audiology at Lively. Christina, thank you so much for joining us. I'll give you the last words here to say goodbye, and stay safe in New York.
Thank you. Thank you, everyone. Thank you, Ben, for having me on here. This was fun.